Hey, you guys. I am back again with a special guest today, Dustienne Miller. She is a physical therapist and a yoga teacher extraordinaire, among many other things, which we will get into. Welcome, Dustienne.
Thank you. Thanks for having me, Ginger.
Yeah, I'm so glad that you're here. We have kind of worked like in like parallel universes, like the same pelvic health universe, but using yoga and doing different things and being all over the place. And it's I mean, when have we been in the same room yet?
Yes, at the Herman and Wallace party at
Oh,
CSM
yes.
in New
In New
Orleans.
Orleans.
Yes, yes, yes. And I was like,
Okay.
"You're Ginger? Oh my gosh, it's so nice to
Oh my
actually
gosh.
physically meet you." Yeah,
Yeah. Oh, I remember
it was a
that.
long time ago.
Uh-huh, because
Yeah.
I want to take that Bruce Springsteen painting home with me.
Yes, right. That's right. Yeah,
That seems like 50
yeah.
years ago. Oh my
It kind
gosh.
of was actually.
It
Yeah,
really was. Yeah, that was
yeah,
pre-COVID, and so it might as
yeah,
well be another
yeah.
lifetime. Well, I want to
Mhm.
brag on you a little bit, so I'm going to read your bio first. I've picked all the stuff that I think is just awesome. So, you guys, listen up to this. Dustienne Miller is quite passionate about combining her yoga teacher training and background with her specialization in pelvic health PT. Before diving into the world of pelvic rehab, she pursued a career in musical theater. And she worked backstage as a physical therapist on Broadway shows in New York. And then I'm getting this right. Then you began your pelvic health
Yeah,
journey after that
yeah,
into
yeah.
PT. And now she has Flourish Physical Therapy, which is based in Boston. And like many of us who started kind of ortho, I do my shoulders and head if you're not watching
Yes,
this on
yes.
video. We all started kind of ortho and then we migrated somewhere along the way into pelvic health. One thing that I didn't know was that you're a professor of theater jazz dance at the Boston
Yes.
Conservatory. Yeah. Well, I'd love to
Yes.
be a fly on the wall.
I wish you
Um,
could come over.
I know. Well, I actually, CSM is in Boston next.
I know I'm not going to be in town.
Oh, no, get out of
I
town.
know the one time it's here,
Oh
hasn't
my
been here for
gosh.
like 20 years. I know.
Yeah, I really
Yeah.
haven't been to Boston. The last time I was teaching yoga therapy there tons and tons of years ago. But you're also a contributing author to two books, Yoga Mama and Healing in Urology. In 2012, she created a great series that I've referred a lot of people to called Your Pace Yoga, which is pelvic health yoga series. And then she also teaches her very famous 2-day CE course for rehab professionals, Yoga for Pelvic Pain, which is kind of like, the bread and butter in the yoga and pelvic health world because I mean it's such a great class, and she teaches that through Herman and Wallace. So welcome.
Thank you so much.
I'm glad you're here today. I first want to ask you about that story and that transition because now it's piqued my interest. Of I knew that you had that background, but I didn't know the specifics, and so set us up for this. You're working backstage on Broadway shows as a PT, and then what made you shift towards pelvic PT?
Yes. Well, our darling Stacy Futterman was
Mm-hmm.
working, yes, and love. She and I worked for the same company, H&D Physical Therapy in New York City, and I was at a different office. And she came into our facility and said, did an in-service, and I thought, well, this is really interesting. And as a feminist, I had learned about that some women had vaginal pain with intercourse, and then I learned that the one of the leading causes of folks going into nursing homes was urinary incontinence. So
Mm-hmm.
I was like, ding, 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 this is super interesting. And then I started taking the courses and was mentored by her before I ended up working for Amy Stein as well. But it was just like fascinating for me because you and I are the same generation.
Yeah,
I don't know about you, but in PT school, there was nothing said about
nothing,
pelvic health.
not a
There just
thing.
it just wasn't there yet.
Mm-hmm.
And now fast forward to folks are having either guest lectures or elective courses or residencies. So it's incredible to see how quickly that has grown
It
over
is.
the 20-year time.
Yeah, I've had several students come in already with The first level, for those of you who don't know, PF1 is like your first level of pelvic floor training. That's offered through a couple of different companies, but these students already have PF1 now and
Right.
an elective and
Right.
guest lectures. And so they're
Yeah.
fortunately going to come out really well equipped to just dive right in, which is great.
Right. And then helping their ortho patients that, by the way, oh yeah, I do leak when I do double unders, or I do leak when I occasionally take a step off of a curb. So then being able to, even if they're not treating pelvic health, they'll at least know how to refer folks or do some kind of basic core save with pelvic floor engagement,
Yeah.
which back in the day just like wasn't part of my vocabulary.
No, so
Right?
many things
Yeah.
weren't. You know, what we know so much now about the pelvic girdle from hip arthroscopy, and that still needs to be, that rehab, needs to be evolved quite a bit. And, that combination of bringing sports med and pelvic floor together. But it brings up a really important point, which is, we have both been PTs for way over 20 years. We've been in this pelvic health and ortho space for a long time. And so we've seen an evolution of no training to now students coming out of their respective schools with some level of training. That will require
Mm-hmm.
more advanced specialty training, but it's better than it was 20 years ago.
Mm-hmm.
However, what hasn't changed are our maternal health outcomes that are actually
Mm-hmm.
worse than they were 20 years ago. So, and there's this dichotomy, right? Here we are improving our medical education training, and we're more prepared than ever to treat pelvic health issues, but our pelvic health outcomes are, and maternal health outcomes are worse. So that means women and people that identify as female, they're not getting to pelvic PT soon enough.
Mm-hmm. Mm-hmm.
So let's talk a little bit about that. What are some of the reasons that you see that people just aren't getting to you soon enough?
Yeah. Here in Boston, we are blessed with a a lot of folks who are both in and out of network. So there is access for people who would need to use their insurance. And then there's access for folks who may have an out of network plan or a cash base. That's not the same for everywhere in terms of accessibility from a financial perspective and also from a practitioner perspective. That being said, most places in Boston are currently still waitlisted. So even though there are so many more people that are trained in pelvic health, there still aren't enough people to be providing the care that people know about. Never mind the care that people haven't gone and maybe like try to market to different sources because like to get the word out more. I'm thinking about, I don't know of any inpatient PTs that are doing inpatient postpartum immediate care here. I don't know if you do in your neighborhood, but
No,
that
that's a
would be
really,
incredible.
yeah, that's a really
Yeah.
high need. And it's a good place to bring up the bill that's currently sitting in Congress. Now, when you're listening to this, the session may be over and the bill may be dead.
Yeah.
However, we are still going to put it in the show notes because it should direct you to the new link because we are dedicated at Academy of Pelvic Health. I was fortunate enough to sit on the task force to help co-write the bill. So I say we, but I also say we collectively,
Mm-hmm.
like all pelvic health PTs um, that are advocating. We are not going to stop until this bill passes because it would provide that care that you're talking about that's really missing. Not just
Mm-hmm.
inpatient care, but also outpatient care. So those of you who are listening, that means if you had, if you're pregnant, if you are postpartum, your provider, physician, therapist, whomever it is, would be required by law to screen and refer you to pelvic PT, which doesn't currently exist. There's no standards for it. So the thing you mentioned about the inpatient care being so high,
Mm-hmm.
need, being so high, and there being little to no representation for that. I had Dr. Rebecca Seagraves on, who spoke at CSM last year. And for those of you who haven't listened to her podcast yet, flip on over and listen to her
Mm-hmm.
podcast because you're really going to be empowered with your rights what you have a
Mm-hmm.
right to. Plus, she's got some great resources there that she'll point you to. But yeah, we don't have it. We don't have, to like get back to your line of questioning,
Right.
we don't have any inpatient, and we're in North Carolina. So think about the Deep South and what's
Mm-hmm.
available in the Deep South in
Sure.
terms of access to care, women having a right and full autonomy over their bodies and their choices. That's becoming increasingly limited in the South. And we already had poor outcomes to begin with. So that's
Mm-hmm.
an area that we really want to see open up to access. And one thing that Dr. Seagraves is also working on, I remember this from her lecture at our national PT meeting last year, which, for those of you who don't know, we call that CSM, Combined Sections Meeting. You'll hear me say that frequently during podcasts. That way you'll learn about what it is. But she's also advocating for this for abdominal surgeries. I mean, a lot
Mm-hmm.
of
Yeah.
33% of births are C-section. So
Mm-hmm.
that's obvious, right? Moms need care for that. And people who
Mm-hmm.
give birth need care for that. But what about all the other people that go home that have abdominal surgeries and they're like, yeah, okay, good luck. And they just cut through
Right.
all the abdominal layers, which
Yeah.
disconnects it from the pelvic floor, among other things.
Mm-hmm.
And then they're given absolutely no instruction on scar care, wound care, mobilization, getting back to, activities, etc. So that is a deep well to discuss of how women and people who identify as female and men too, and
Yeah.
trans individuals, everybody, just we're not getting the pelvic health care we need. And
Mm-hmm.
oftentimes it comes across as even like gaslighting. Like, I've heard patients come in, and I know you've heard this too, the classic, well, why would, and they've asked their practitioner for pelvic PT and or OT, and the practitioner's like, well, why would you need that? You just gave birth. It's like,
Yes.
not,
Right.
we don't refer for that.
Right. Or you don't have leakage or you don't have prolapse and you haven't had a grade 3 or 4 tear. So it's fine. You'll feel better once you're done breastfeeding.
Oh, oh,
Right. Yeah. 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 Yeah.
just that
Yeah.
actually makes my arms tighten up, and
Yeah.
it makes me so angry, and also super compassionate for the people that are sitting there listening to that drivel, come out of
Yeah.
a person's mouth. It doesn't even need to be the practitioner. It could be anyone saying, "Oh, well, you're not leaking, you must be fine,"
And can you
or,
imagine having, oh, sorry, please.
"Oh, well," or it can come from like support agents, like your own. I've had spouses say, "Well, our friends didn't have this problem. Why do you have this
Oh,
problem?" You know?
I see.
Yeah.
Mm. And I think that is the problem, is the word problem, because the challenge, I think, is it's getting a lot better, but how do we frame postpartum wellness,
Mm.
or actually human wellness, to be fair, for all things, but
Mm-hmm.
how, if we're thinking specifically in the postpartum period, how do we reframe and rebrand that everyone who has gone through this experience deserves, and in my opinion, and I think you probably share it, needs to come in at least for 1 or 2 wellness visits,
Yeah.
even if they're asymptomatic, because they've had all of these massive pressure changes. Interabdominal pressure is different. The body has different proprioception about where it is in space. We no doubt have orthopedic things going on with the feet, the hips, the back, the SI, et cetera. Thorax is a big place that we look at. So how do we help people find their center again, which is also a language that you and I share around
Yeah.
using yoga and mindfulness as a treatment method postpartum. Find your center again, know how to move from that space that has been different for 9 months. As there's a hormonal storm going on,
Mm-hmm.
increased stressors at home, you're probably overwhelmed in the initial post period
Mm-hmm.
time
And
emotionally. So
yeah.
biopsychosocial things are all different. So
And I
I
I
think if we
also,
can, yeah.
oh, go ahead.
Oh, I was just going to say, I think if we can, the more that we continue to do, and this has been, I've seen a massive change in this just from people connecting with other folks that are postpartum as well, and support groups, destigmatizing that PT or OT postpartum is just if you have, quote, symptoms. And that also is changing, I think, in the residency programs. At least some of the folks that I've talked to, they're learning more about it. Some of them have gone through PT, OT, postpartum as well. So it's definitely a grassroots effort for sure. I think social media has been helpful for that as well.
Mm-hmm.
And maybe we'll catch up to France someday.
I know,
maybe.
they do so many things right. And one of them is actually postpartum care. You mentioned biopsychosocial, and for our listener, biopsychosocial is just a whole person way of looking at you. It's not just, oh, you're postpartum, you had a baby, or oh, you're menopausal, or you're post prostatectomy, or whatever it is. It's a whole way of looking at you, your biological needs, your psychological needs, and your social, spiritual, relational needs. And so one of the things that about this whole biopsychosocial approach that's important and is what is going to take us into our next segment is the fact that people come in, and we were talking about postpartum, so we'll stick with postpartum for a second. People come in with these postpartum needs, and they usually, it's been a circuitous route, particularly in the North Carolina and the Deep South. They've had to jump through hoops. They've been gaslit. They've been told they didn't need it. They've been questioned by their partner. Maybe they don't have support. I have moms all the time bringing their babies in, which, as a mom of 3, I will take baby fix any day. Cuddling them up because my teenagers. Right?
Say no more.
So these moms come in, and oftentimes, it's birth can be a traumatic process, even if it is beautiful at the same time. I think Glennon Doyle calls it like life is brutal. It's brutal and it's beautiful. And so I like the way she describes that. So even if the birth went well, right, and oftentimes they don't because of the medicalization and so much happening, I think it's important to note that moms, in addition to whatever support they have at home, the identity change, all of a sudden self-care while they're trying to like keep a new small human alive, they might be coming in to us with trauma from inside the system, like they've been traumatized by the system. And so that's a big, I always try to be really sensitive to that. And for those of you guys listening, find a practitioner who's doing that for you, that's asking you, how was your birth? Did you feel listened to? Do you have support at home? Do you feel safe at home? Do you feel safe talking to your practitioner about your needs? Do you feel heard, right? And then providing that safe space is, that's kind of the biopsychosocial, magic of care, which kind of leads us to like why you and I have both been using yoga for forever and ever. Forever and ever and ever. So that was my next question is, what was your transition into yoga? Because I think everybody knows by now, like yoga is good for you.
Right.
You don't have to argue about it.
Yes.
There's been enough books and papers written on it. And even if a book and a paper had never been written, just go feel it. You feel better, So how did you drop into that space?
The
yoga space.
The yoga space, yes. I first started using yoga as a way to warm up my body before shows, and also as just another mobility thing for flexibility for dancing. And I went to Kripalu and I got trained there, and I loved it there. And that's where I really learned how to meditate deeper. And that became a very pivotal experience for me, having then started to develop panic attacks in my 20s. I was able to then have a strategy of calming my nervous system down after the wave of the panic attack, because I don't know about you. To sit and breathe during a panic attack is not a strategy that will work for me, because it will just amplify the feedback I'm getting in my system.
Mhm.
And then I will start to go into the place of diagnosing all the things that could be happening to me from a cardiovascular perspective that are not
Oh,
happening.
oh
It is a
goodness.
ruse. It is a ruse. So closing that loop of that of that panic moment has been incredibly helpful, to the point where in my 20s I went to the ER twice, and I have not had any problems, and thankfully haven't needed any medication to navigate that time. It honestly feels like a very distant memory, thank goodness. I'm sure as I'm perimenopausal now, that's going to present in different ways. And I hopefully have the strategies now of noticing my nervous system when she ramps into the sympathetic override,
Yeah.
working with it, and having enough self-care laid out foundationally to navigate when things start to go haywire.
Mhm.
So all that to say, that was my interest initially was from a musculoskeletal perspective, and then it morphed into the nervous system spiritual perspective, and then it worked into, because I wasn't doing PT during that time when I was performing, and then when I turned 30, which is when I got back into physical therapy, and then I started integrating it into the pelvic health world, because it just so beautifully meshes in there. When you're working with vaginal pain or testicular pain or rectal pain, and there's this compressive quality of the pelvic floor, and that's
Mhm.
maybe part of the pain driver, I think it's so helpful to work with the idea of softening, the idea of warmth and loosening versus going after trigger points. That can work, but there's another way that helps support the nervous system even more.
Yeah. It is what I always have felt like kind of yoga among other systems of medicine are indigenous to their particular regions of the world and to people, and they were developed over centuries of time where it was experiential. You try something and it works or it doesn't work, and then it begins to work for hundreds of thousands and millions of people. And so I think about the modality um, of yoga as not just being a modality, but being a way of breathing and living and moving through the world. And so when you described dry needling, like a trigger point, or a tender point could work, it's kind of the same thing as, yeah, you could like you could stick something, you could take a pill or you could do a quick fix for something, but you still have to come back to the experiential point of changing your mindset.
Mm-hmm.
That does change our muscles. It does change the endocrine function, which means the hormonal function that our muscles and our body can have, because every time we move, it's an action in decreasing inflammation, or how we think increases
Mm-hmm.
inflammation, including what we eat. So I try to look at it like that and explain it to people like that too, who
Mm-hmm.
may think, yoga is just a bunch of breathing and movement. I already do Pilates, right? I already do,
Mm-hmm.
um, I already run. I get my mind shift and my adrenaline high, but there is something very specific about yoga, as I kind of sometimes think of it as kind of original system of lifestyle medicine, you know?
Mm-hmm. Oh yeah, for sure.
Yeah.
Mm-hmm.
So, what are some of your favorite go-to yoga? I don't want to say intervention. That sounds so clinically
Clinical. Yeah.
antiseptic
Yeah.
and
I
dry
know.
and boring. It's like,
Yeah.
okay, let's talk about yoga. What do we like to do? What do you like to do for some of the most classic things that people come in with? Because I think that there's still a misconception that, you know, going to a pelvic floor PT means they're going to hand you a sheet of strengthening exercises and stretch
Mm.
your hamstrings and send you out the door with a pat on your back. And that's so not it, because pain
Right.
is so layered and complex.
Mm-hmm. Mm-hmm.
So that means instead of working on what we call up training, right, in PT, of
Yep.
strengthening and getting stronger, which is great, we want to do that, but a lot of times we need to address the trauma or the pain or whatever is keeping things uncentered,
Mhm.
sideways, off balance,
Mhm.
not feeling good.
Mhm.
So what are some of the things that you like to do when people come in and they've lost that center?
Yeah. I think it looks different for, obviously, it looks different for everyone. But when I think about this question, I think about how, if you were observing this is my practice. If you were here today with me and you were taking notes and you were to say, what here was influenced by Dustienne's yoga background and what was influenced by physical therapy school, I think it might look potentially different to people newer to yoga or brand new to yoga than it would to you. And this is kind of where my brain is going. I think that one might think, oh, she's doing a lot of sun salutations in her treatments. She's doing, I have to come wearing, back in the day, unitards. Now I have to come in yoga pants. I have to be a vegetarian. But how it might show up in my clinic is, how is the person, when they take a breath, how are they breathing? And this is also in the traditional physical therapy model. Are they getting a lateral ribcage expansion? Is one side staying stuck out or stuck in? But instead of me just noticing that, I'm asking the patient, can you, if you feel comfortable, would you mind putting your hands on your body, helping them develop more interoception, proprioception, mindfulness? Because if they can, the more mindfulness they can reflect during the session and audibly speak out, I think the more empowerment they will have over their system and more self-efficacy to then have the confidence that they can change their patterns, that they can change if there's a lot of muscular holding patterns.
Yeah.
Um, so I think mindfulness is a huge piece, especially when I'm working with people that are doing dilator training.
Mm.
Can we use the dilator as a biofeedback tool? Can you imagine softening around the dilator? What does it feel like? What are you noticing? And then maybe cueing back into the breath. If we're looking at a 3-part breath for the folks on the call that are yoga practitioners looking at the Dirga breath, I may not cue a traditional Dirga breath if they're already upper lung dominant breathing
Mm-hmm.
from the collarbone anyway. So it becomes a customized pranayama, for example. If I notice, oh, this person has a lot of neural tension, so maybe they have a lot of tightness down the back of the leg, maybe they have some sciatica, maybe I would be working in doing a rock back from all fours with softening breath, imagining the sit bones widening to create more space for the pelvic floor as they're coming back. And then integrating movement with breath. And notice, does it feel different when you inhale on the way back? Does it feel different when you exhale on the way back? And then grading that. So if we're thinking of graded exposure being one of our methodologies, I guess, for lack of a better word,
Yeah.
then we grade that up into maybe a sciatic nerve glide, and then maybe that goes into a downward facing dog. So it will be part of a home program that's specific to that person if the person is interested in looking at that lens. And usually they are. If they've come
Mm-hmm.
here, they usually are interested
Yeah.
in that. And also I think it's just such, in our culture now, mindfulness is so commonly practiced as well,
Yeah.
that it's not super foreign to my patient population, which is very
Mm-hmm.
different than other folks, I'm sure, around the country and the world.
Yeah. So let's back it up for just a second. You started out with describing dilators. So,
Mm-hmm.
and then you went into Durga Pranayam, which we know as 3-part breathing. 3-part breathing is where you start and you inhale kind of, and it depends. Some people start in the belly. I like to start it in the pelvis, inhale into the pelvis and into the
Mm-hmm.
belly. And then because of the um, altered breathing patterns that people often come in with, I don't do the top part of the 3rd breath and I keep it down here
Mm-hmm.
in the rib cage. So that's
Mm-hmm.
3-part breath, which you can easily find videos of online. I know we both have videos of those probably. I know I do on my YouTube channel.
Yep.
Um, but let's back that up. So let's just say they came in with and they needed use of dilators. What are some populations that would actually benefit from use of those dilators? And then let's describe like what that feels and looks like for their breathing before they may then go into something like child's pose.
Sure, great. So let's think about our postpartum population since we started talking
Yeah.
about those folks. Yeah. So some people may have been told throughout their pregnancy, you should do Kegels, do a lot of Kegels
Mm,
so you don't have issues postpartum. And maybe they had more holding patterns even prior to their pregnancy for multiple reasons. It could be pelvic pain, endometriosis, constipation, bladder pain, hip dysfunction, back dysfunction, etc.
trauma. Yep.
Yeah, 100%, 100%. And we know it can be all sorts of scary physical, sexual, mental abuse, trauma, and it could be medical trauma from not, being able to speak up and say, "Hey, what do you think about? I heard about pelvic PT," and then it's, "Oh, you don't really need that." That's like a little T trauma that you
Yeah.
had the courage to speak up, and then someone said, "No, that's not a good idea."
Mm-hmm.
So if there is any pelvic floor tightness, because the pelvic floor muscles are going from outside to inside, very often we can help get more comfort and more range of motion in the muscles, especially if we're trying to do any sort of penetrative activity with a dilator for circumference. And I don't think of it as much as of stretching the tissue as much as offering the brain some feedback around how to soften around the dilator. So we know that with manual therapy, it's the pressure, vibration, heat on the mechanoreceptors that create that change in the fascial system. So that's why in my practice, I have had a lot of luck working with the mindfulness piece around if you're going to use a dilator, notice what it feels like to put it right at the vaginal opening. Do you find that your pelvic floor is going into a Kegel? Great, good noticing. Is there another option? Can you soften and come back to that baseline?
Mm-hmm.
And then can you imagine, I have a little model here for the folks that are on
Oh,
video.
yay.
Here's,
I love
yeah,
that model.
isn't it
Mine's falling
great?
apart. I need to order another one.
Yes, it's from Marie Josie Faget up in Canada. So sit bones are here. We can imagine that as you're inhaling, that your sit bones are broadening and that the tailbone is reaching away from the pubic bone as you inhale. And I think that's really helpful to have these bony landmarks in mind because the pelvic floor can be such this ethereal thing that we don't see on a regular basis. Unlike the shoulder, if my upper trap is up and my shoulder's up, I know it because I can see it in the mirror. It's there. I can let that go. So having bony landmarks to palpate yourself can be helpful. And then we could use that with the dilators. We could use that if we're thinking about softening in child's pose. You could reach around, palpate where the sit bone is, where the pubic bone is, where the tailbone is, and then where that diamond shape of the pelvic floor muscles are, and then imagine softening with the breath to help create a new motor pattern of not holding. And I've seen this in runners who maybe they don't have vaginal pain or any pain with vaginal penetration, but maybe the obturator internus high up in the pelvis is tight and they may need to use the wand a little bit once a week just to kind of maintain a happy pelvis. We're able to get the muscles released from the inside, just like we're able to release them on the outside.
Yeah. And for those of you curious about that, I hope that explanation helped because you can already see that Dustienne mentioned the one little muscle called the obturator internus. It's kind of a home wrecker for the pelvic floor and can be rightfully blamed for a lot of things. And it's actually a hip muscle. So you can see already there's this broad overlap between if you've had a hip scope or a hip
Mhm.
replacement, or maybe you
Mhm.
just had knee pain. It can
Mhm.
track up, it can be internal,
Mhm.
it can be associated with the hip that impacts the pelvic floor. So when
Mhm.
you, even if you have an orthopedic injury and you're not postpartum, or if you're postpartum and you didn't tear, you can still have these issues crop up
Mhm.
that are really, there's an intersectionality of them that almost requires that at some point in your life, you're going to need pelvic PT or OT of some sort.
Mhm. Yeah, you have a foot injury and you start walking a different way for 2 months, and then once the foot hits the ground, all those forces go right up into the pelvis and above. We're all
Yes.
connected. Yeah,
So
our
when
whole
you come
body.
into something like child's pose, in yoga that Dustienne mentioned, and you're using maybe a yogic breathing technique, I think we probably start with our basic gold standard, diaphragmatic breath, get the rib cage moving, get the pelvic floor stretching. And then you might progress into something that looks like child's pose or looks like a variation of downward facing dog that is it is accomplishing so much at one time. I really think of using yoga as a very efficient way of doing
Mm.
usually 6 or 7 things at one time for
Mhm.
relaxing, releasing, resetting, being curious about movement, decreasing fear of movement. Um,
Mhm.
I mean, the list of benefits go on, not to mention what you talked about in the beginning of, in your own story of it recentering us in a way that calms the nervous system. Much like if an infant is feeling a little sideways and is upset,
Mhm.
we can swaddle them or bring their arms to midline. It's just like a hug,
Yeah.
like a
Yep.
long 20-second hug. It doesn't matter if you're a neonate, if you were just born
Yeah.
yesterday, or you're an adult. We all need that nervous system reset.
It's amazing how quickly, if you come into child's pose, my preferred way is for my body, everyone's different, is to stack my fists and put my forehead on my fists. And
Mm-hmm.
if your body doesn't allow if your knees don't allow you to do that, you can also do this over a chair with a bolster. There's a lot of ways to make these postures work beautifully for you. But if you really close your eyes and then soften and take 5 breaths, you can feel this down regulation so fast. And I know you know this, Ginger. I'm just like reminding myself
Yeah.
because it's how many times I can't tell you where I get to the end of the day and I think I haven't done a yoga posture today. I haven't stopped to meditate because I found that email more important in the moment. And
Yeah.
it's like, this is such valuable, um, easy, free strategies that I think they just end up getting pushed to the back burner because you're putting out other fires. And I know for what I try to do here is whenever I wash my hands between patients, I try to notice the water. I try to feel my feet on the ground. I try to just be in my body. And it's fascinating how quickly technology can take us out.
Mm-hmm.
So if anyone on the call is like, I hear you, know that I am
Yeah,
definitely, not practicing 100% the way that I like to be because I'm a human being and you're not alone. Don't feel ashamed
that's
if you
right.
fall off the wagon because it's
That's right.
normal human nature.
The beautiful thing though is as because we all know about that negative self-talk, that
Yeah.
self-destructive self-talk. Um, as soon as you notice it, you're already mindful.
Yes. Yes. And you can say, oh, thank you so much for letting me know. Okay.
Yeah,
I can let
yeah.
that float away like a cloud.
Yeah. Yeah. So
Yeah.
when you notice it, instead of like moving into the typical realm, because I've done it, the typical realm
Yes.
of, oh, you didn't do your 10 minutes of yoga or whatever a day, instead of then moving into the continuing to beat myself up phase,
Yes.
I stop there and go, you noticed it. That is mindfulness. Full stop.
Yes.
I wonder what my next thought will be now. And just
Yes.
move on from there. And
And you avoid that second arrow of shame.
Yes.
which is great. Yeah.
Yeah, yeah.
Yeah.
And it's the other thing is, and this is very steeped in yoga philosophy, and the cliches. You can look those up if you're interested in learning more about them. But it's very steeped in yoga philosophy because it tells us that we don't ever like perfect anything. We don't
Mhm.
lose our ability to lose our patience. We don't lose our ability to
Right. Right.
sometimes be self-centered or whatever that is. It's a continuum that we come back to and then ask ourselves, um, I wonder what our next thought will be. I wonder what my next thought
Mhm.
will be. Let me just take a long breath and come full circle again and realize, oh, I can respond better to myself or to someone else or in a situation.
Yeah.
And I think that's the difference between going to uh, a physical therapist who's not integrative and is not using those techniques and one who is, because it's very psychologically informed.
Mm.
We're
Mhm.
asking, we are asking you as you know if you are our patients who are listening, if you are our clients who are listening, if you are someone we care about, right, and you're listening, we would ask you those questions, right, to bring you back around,
Mhm.
because the other thing is we could design the coolest, most effective yoga program ever, but if you haven't, if no one's addressed how you're going to do it, how you're going to accomplish it, if you have
Yeah.
the support system to do it, if you have the time to do it,
The time. Yep.
then
Exactly.
it's ineffective, you know?
Right. Right. I
So I think,
remember
yeah, go ahead.
my
Go ahead.
favorite, my number one favorite meditation teacher, Tara Brock, who's just the coolest ever. She said when her kid was little, there would be days where she would collapse at the side of the bed, close her eyes, take a few breaths, and say, okay, that was my practice for the day. Because
Mm-hmm.
there are times when you just don't have
Mm-hmm.
the bandwidth and the space, and having the grace during
Yeah.
those moments to be okay with that. That was a
Yeah.
very beautiful offering, I think, to just to get out of that shame space of I should be doing more, I should be
Mm-hmm.
doing more. Yeah.
I remember feeling the pressure of that when my kids were little, and having to recalibrate everything I thought that I knew about yoga really in practice.
Mm,
As one came along, then two, then three.
mm,
Um,
mm-hmm.
and I had a less gracious response than Tara did. I remember finishing my practice. I actually got to practice.
Yeah.
It was strength based, but also very mindfulness. So I was sweaty, and I was getting ready to do shavasana. I'm like, I've got like 5-10 minutes before my kids like all descend, and that's it. That's no more. I'm like, damn it. We can swear, by the way.
Yeah.
I said, damn it, I am recalibrating shavasana. I'm not going to lay here in that corpse pose for 5 or 10 minutes and then not get to take a shower tonight before
Mhm.
the kid stuff
Mhm.
comes in. I said,
Mhm.
my shavasana is going to be, I'm taking a shower. I'm taking, a bath. And I think I got in the bathtub that night and said, for this 10 minutes, that's my shavasana.
And mindfully.
Yeah.
That's so beautiful. Yeah. What does
Yeah.
my body need right now? What is
Yeah.
going to support my body? Yes,
Mm-hmm.
exactly.
Yeah.
And that
Because I
idea
was
of
just guilting
restorative rest.
yourself. Yeah.
Yes, exactly.
Mm-hmm.
Why? Why put yourself through that?
Yeah. And
Mhm.
and it was very practical too, because a lot
Yeah.
of some of the, a lot of the history, well, all of the histories of yoga, let's just be real clear on that, is patriarchal in nature.
Mhm.
So
Mhm.
we have subscribed to a system that was never evolved for women until
Mhm.
we start breaking the rules and evolving it for women. And so I was still subscribing even then, like 20 years in at that time. This was over a decade ago. I was
Mhm.
still subscribing to that patriarchal, you must do it this way. And then you've got to do your, shavasana or whatever at the end. I was like, that's just BS, you
Yeah.
know?
What do I need in this particular moment?
Yeah. Yeah.
Yeah. Yeah.
All right. We
Love
could
that.
just keep on talking about that. But I think that was my next question, but I think we just did it. The next question was, um, are there any yoga myths that you'd like to break? And
Oh, yeah, I think we kind of talked about that because kind of how, one would expect if you come to PT with me, it's going to be, unless somebody's coming in specifically for a yoga home program, which I
Right.
will do that and I'll collaborate with other PTs.
Hmm.
I'm probably much like you. I'm very manual based. I'm looking head to toe. I'm looking at the neck. I'm looking at the jaw. I'm looking at the feet, so we're not going to be doing, the key to rehab is, in my opinion, is not just a yoga home program. So, but
Yep.
yeah, in terms of myths, I think that at least the way that I have grown my practice over the years has become more integrated into my day to day. Whereas in my 20s, I was doing, 30 to 60 minutes a day, and that was great
Hmm.
for me at the time. I'm in a different season of life. I like to integrate it when I'm with my patients. When I demonstrate, I feel my body, I breathe while I demonstrate on my good days,
Yeah.
if I'm not in my head too much, right? Right.
Yeah.
Um, and then there are the days, like I mentioned before, it's like, how is it noon and I haven't done a downward facing dog? How is it 5 and I haven't stopped to do a 10-minute meditation at lunch? So there are those days that I could have maybe had a different path that would have involved more yoga. And there are days where my yoga practice for that day might be feeling my feet in mountain pose as I'm waiting in line at CVS or something.
Hmm.
I think it's just about integrating your nervous system. I like to notice trees. I like to notice beautiful architecture when I'm walking around the city. I like to take my earbuds out. I like to notice how I'm breathing and feeling. And so it's really evolved to, I guess, more of a mindfulness practice with some asana and pranayama involved
Hmm.
in a non-structured way.
And that really speaks to two things. It is yoga being, because we've been talking about yoga being great for pelvic health specifically this whole time, but yoga is your self-care too, you know,
Mhm. Mhm.
for you as a person if you're going through pelvic pain,
Mhm.
but also you as a practitioner.
Yeah.
Um,
Yeah.
yeah, and that's what I absolutely love about it because I can integrate it into my day. When the kids were little, I do, yoga with the kids in little tiny snatches of time. Now it's in the
Yes.
clinic, with patients in bits of time throughout the day. Um, so that is a really good place, I think, to ask my last question. And that is, where can people find you on Instagram, on like your website, your resources? Because we can never have too many resources.
Yes, yes. I will say I have been a bit negligent on the social medias, but I do have some sites, Your Pace Yoga and Flourish Physical Therapy, both on Instagram. I'm on Facebook. I used to do Twitter, but I'm not really for many years. My yoga videos, if anyone wants a home program, they're about 15 to 20 minutes, little nuggets that I developed for folks that maybe are looking to return to yoga or are new to yoga and are maybe working with some vulvar pain or bladder pain. And those are all on my website, yourpaceyoga.com. And I do have on the Insight meditation app, I have a sits bone meditation that I really like for folks who are want to map around the sit bones
Hmm.
to kind of notice bring more awareness into this body part because awareness is the first step in terms of changing
Yeah.
motor patterns. So
Yeah.
that's for free on the Insight, and you can even just like go on a browser to get to that.
There's
Those
so
are
much
probably
going
my
on in that little area that you just pointed out,
so much.
that
Yeah.
any awareness you can bring to that really changes your outcome for changing pain and
Hmm.
stress too. Yeah.
Yep. And spine and hip and beyond the
Hmm.
pelvic floor. Yeah. It's
Yeah.
all connected.
So
Yeah.
we will make sure all those resources are in the show notes for you guys. And my final question is, I would ask you, but I already know the answer to this, what your
We got
favorite
it.
thing to do is, like your fail safe chill pill. But y'all, we've been talking about it for
Oh,
a whole hour, so we know what our
yeah.
fail safe chill pill is.
Yeah.
It's yoga. But Is there a favorite song or a book or something that's like really resonating, because, with your musical theater background and everything,
Yeah.
what's doing it for you
Yeah.
these days?
I would throw out a shout out to restorative fish pose on a bolster, especially
Mm,
for folks that are on computers all day and or treating therapists.
mm-hmm.
Um, Something that comes to mind is the Julia Louis-Dreyfus podcast, where I
Oh,
don't know if you've heard that,
no.
where she interviews, it's called Wiser Than Me, and she interviews all of these older women that are just nuggets of wisdom. That was phenomenal to listen to. And I love
Awesome.
PBS masterpiece shows. I'm super addicted to those.
I
Those are
love
really
them
fun.
too.
Yeah. And today at the conservatory, I'm teaching a combination to Transylvania Mania from Young Frankenstein, as we are in the Halloween
Oh,
vibe today. So that's what I'll be doing next.
oh, fantastic.
Yeah.
I would love to be a fly on your wall.
Oh my gosh, that would be so fun. And then you could bring
Oh,
all of your knowledge about the voice and pelvic floor to my students. They would love that.
yeah. Oh my gosh. Maybe we'll
Yeah.
get a chance to do that sometime. I
That'll
would
be
love
cool.
it. I would love it.
Yeah.
Thank you, Dustienne, for being with
Thank
us
you.
today and taking the time to be here. I appreciate it.
Yeah, it was an honor for you to invite me, and I really truly enjoyed our conversation. So thank you.
Me too. Yeah, a big old Southern namaste.
Yeah, same to you.